Thank you. And date of birth?
080582.
Okay. And female?
Yes.
Okay, perfect. Marital status?
Married.
Married. Perfect.
Yes.
Thank you. Number of children?
5, 1 on the way.
And your address?
It's 120 Johnson Avenue, Piscataway, New Jersey, 08854.
Okay, perfect. I'm going to grab your phone number from the information I already have for you and your email address.
Okay.
Were you referred by anyone?
No.
No? Okay. Are you currently receiving psychiatric services?
No.
Emotional counseling or psychotherapy?
No.
Okay. Have you had previous psychotherapy?
No.
No. Okay. Are you currently taking any prescription psychiatric medication, antidepressants, anything like that?
No, I'm not.
Okay. Perfect. Have you previously been prescribed any?
No.
Oh, I think stopped recording. Shoot. So my backup here stopped. I'm going to give me just a moment.
Okay, no problem.
Well, I try to make some space here. Just so that we're not starting back from 0.
Okay, no problem.
Alright. My goodness. Okay, let's see if this creates any more space for us.
Okay.
Oh, man. Sorry about the pause.
No, that's fine.
Nope, my backup is no longer working. So is your backup working? Yes, perfect. That was mine, and it stopped. Okay, we'll get back to it then. Sorry, Professor. Okay, let's see. Let's move on to health and social information. Let's see. How is your physical health?
It's okay.
Okay.
It's good.
Poor and unsatisfactory, satisfactory, good, or very good?
It's good.
It's good? Okay.
Yes.
Any persistent physical symptoms or health concerns?
Just I do trouble with a lot of headaches, migraine headaches.
Okay.
So that's the issue.
Great. Okay. Are you having any problems with your sleep habits?
Yes, my sleep habit is a little bit poor, probably because of the pregnancy. So I'm a bit off.
Yeah, that affects everything.
Yes.
Everything. Okay. So are you sleeping I'm assuming you're sleeping too little?
Yes.
And do you have poor quality of sleep?
Yes.
Or disturbing dreams?
I do have poor quality of sleep.
Okay.
Dreams are okay.
Okay. Anything else around that?
No.
No? Okay. How many times a week do you exercise?
Probably one or sometime none.
Okay. That's probably really fair right now. Okay. So when you do get to exercise, approximately how long?
Probably about 20 minutes or less.
20 minutes. Lifting laundry baskets.
Exactly.
That's how that works. Get that. Yes. Are you having any difficulty with appetite or eating?
No.
No. Okay. Have you experienced significant weight changes in the last 2 months?
No, apart from pregnancy, you put on a lot of weight. So.
Yeah, that's how that works.
That's it.
Do you use alcohol?
No.
No. Okay. Do you ever engage in recreational drug use?
No. Never.
No. Okay. Have you had suicidal thoughts recently?
No.
Nope. And ever in the past?
No.
No. Okay. Are you currently in a romantic relationship?
Yes.
Yes. Okay. How long have you been in this relationship?
16 years.
That's a long time. On a scale of 1 to 10, how would you rate the quality of your current relationship?
8.
8. Okay. In the last year, have you experienced any significant life changes or stressors?
Um, to be honest, yes, last year I had a newborn last year, and then that was a big stress, and then
Yes.
and then find out that I was pregnant again.
Yes. Oh, that's a big life change.
Yes, so it
Absolutely,
was.
having two babies.
Yes, so that was a hit.
Yes,
Yes,
surprise.
yes.
Yes. Oh my goodness. Okay, so we're going to go through this next list, and it's either yes or no.
Okay.
So, extreme depression,
No,
extremely depressed mood. No. Okay.
no.
Wild mood swings.
I do. Yes, I do believe I do at times. Yes.
Okay. Rapid speech.
No,
Okay. Extreme anxiety.
no.
Panic attacks.
Yes.
Oh. Phobias.
No.
Okay. Sleep disturbance.
Sometimes yes.
Okay. Hallucinations.
No.
Unexplained losses of time.
Yes.
Okay. Unexplained memory lapses.
Yes.
Alcohol or substance abuse.
No.
Frequent body complaints.
No. Apart from the headache, no.
Okay. Eating disorder.
No.
Body image problems.
No.
Repetitive thoughts like obsessions.
No.
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 Okay.
None of those.
Repetitive behaviors like frequent hand washing.
No.
No?
None of those.
Homicidal thoughts.
No. None.
Okay, great. We've just got a couple more pages here, and then we're done with the intake.
Okay.
Any suicide attempts?
No.
Okay, we're going to switch gears to occupational information. So,
Okay.
Are you currently employed?
I'm a pastor full time, so pretty much that's it.
That's it. That's a lot. That's a lot. So. And you're a mom, so
Yes.
definitely busy. Okay, are you happy at your current position?
Yes, I am.
Okay, great. Do you have any work-related stressors?
I would say the ministry just and the managing the ministry and home, it's indeed a lot to deal with.
Yes, I can imagine. Okay. So do you consider yourself to be religious?
Very, yes.
Yes. Okay. If yes, what is your faith?
Christian.
Okay. We're going to switch gears again to family mental health. And we're just going to go through a quick history.
Okay.
So we're talking about family members, siblings, parents, uncles, etc. So the first one is going to be depression.
Okay.
Any family members with a history of depression?
Yes, my sister.
Okay. Bipolar?
No.
No. Okay. Anxiety disorder?
Anxiety. I would say yes, my sister does. Yeah, she definitely.
Okay. Okay. Panic attacks?
No.
No. Okay. Schizophrenia?
No.
No. Okay. Alcohol or substance abuse?
My brother with the alcohol and I think yes.
Okay. Okay. Eating disorders in the family?
No.
No. Okay. Learning disabilities?
No.
Okay. Trauma history?
No.
No. Okay. Any suicide attempts?
Yes, my niece.
Okay. Thank you. Okay. One last gear shift here. We're going to talk about some other information. Let's see. So, what do you consider to be your strengths?
My strength is having the ability to multitask and get things done in a timely manner. So yeah,
That's great.
yeah,
Very helpful with everything you have going on.
yeah. I have to manage.
Needed. Okay. What do you like most about yourself?
I'm very faithful. I am loyal. I would say I'm another quality. I like the fact that I'm very committed. Yeah.
That's great. Those are all fantastic qualities. Okay. What are effective coping strategies that you've learned?
Meditation is one, and reading my Bible, and I guess I feel more at peace and I'm more relaxed when I'm in church. May not make sense to a lot of people, but that's where I get my peace from. As long as I'm in church, I'm okay.
Yeah,
That's how I
I
deal
completely
with.
understand.
That's how I deal with
Yeah.
stress.
The smell of the church, it's
Yes.
comforting. It's tangible. You can touch it, smell it, feel it.
Yes.
Yes, I can understand that. Okay. What are your goals for therapy?
The goal that I have is the fact that I want to have some form of balance in dealing with stress, because sometimes I internalize stuff and I don't really speak out, and I think it creates creates some problem where I do at times feel like I'm having panic attacks and stuff like that. So the stress of everything, just keeping everything in, if I could just be able just to speak my mind and just to release myself, I think that, yeah, I'll be able to feel a lot better.
Okay. Well, this sounds great. We're going to get into this more in future therapy sessions. This is a good place to start. I'm going to recommend that you take the Hamilton Anxiety Scale for anxiety.
Okay.
And we're going to start there and then talk about some self-care things that we can talk about. Maybe carving out some more time for yourself.
Yes.
Finding a way to let the sense of control and responsibility go a little bit.
Yes.
Maybe putting yourself on a better, healthier path that allows you that freedom.
Yes.
Because it sounds, sometimes it's hard to walk away from stuff and let the little things go.
That's true.
But we can help you with that and get you going on a really good path.
Okay, I would love that.
Yeah, we'll practice some self-care more than 20 minutes once a week.
I know. I'll try. Put that. Make sure I start getting that done.
Yeah,
Thank
especially
you.
with little ones in the house.
I know. Oh, thank you so much. I do appreciate that. And so, as we switch role,
Okay.
we have scheduled an appointment for today so that we could have done a client intake form. And what this intake form is, just to have a record so that I can have a better understanding on where you are, who you are, how your family contribute to any problem or issue that you might be facing. So at this time, I'm just going to ask you a couple questions, and as we go further down, then I'll be able to give you a proper assessment on how we can help and get you on the right path. May I have your name, please?
Okay, sure. It's Jessica Stackpool.
Okay, and your address?
It's 8025 West 5th Avenue, and that's Denver, Colorado, 80226.
Okay, and your date of birth?
It's 11/9/1977.
And I can clearly see that you're a female.
I'm a female, yes. Yep.
Okay. I think I could have your phone number. I have your phone number and email. So, did anyone refer you to this institution? No. Okay. Are you currently receiving any psychiatric service, professional counseling, or psychotherapy elsewhere?
Yes, I am doing couples counseling with my husband.
Okay. And the name of your therapist is?
Kate.
Okay.
And I don't know her last name.
That's That's okay.
Really don't. Like it's like Nerwitz or something. I have no idea.
Okay. Are you currently taking any prescribed psychiatric medication like antidepressant or anything like that form? No?
No.
Okay. Have you previously in the past have done any medication concerning psychiatric?
No.
No? Okay. Okay, at this time too, as we go forward, I want to get a better understanding of your health and your social information. How is your physical health at this present time? Is it poor and satisfactory, good, or very good?
I would say good.
Good? Okay.
Yeah.
Okay. Is there any physical symptoms of health concerns do you have, like headache, hypertension, diabetes, chronic pain?
Yeah, I have a pretty consistent upset stomach.
Okay. Okay. Are you having any problem with your sleep habits? No. Okay. And you sleep very well?
Yes, I would say I sleep.
Okay. Okay. Yeah. Well, you know that a lot of time we do find things to kind of help us to maintain balance. How many times per week do you exercise?
At minimum 5.
5. And approximately how long each time?
At least an hour.
Okay. And you don't have any difficulty with your appetite or your eating habits?
I do. I eat very little.
Okay.
Because of the upset stomach.
Okay, got you. Okay. And have you been able to, are you experiencing any significant weight change in the last 2 months?
Yes.
Okay, and that's a result of the upset stomach.
Yeah.
Okay, and do you regularly use alcohol? Drink?
I do on weekends, Friday nights or Saturdays, or sometimes both.
And typically, how many drinks do you consume in about 24 hours?
But probably around 3.
3? Okay. Have you been engaging in any recreational drugs?
No, never.
Okay. You know, sometimes we go through some stuff and we're not able to process it. Have you ever had any thoughts of suicide recently or in the past?
No.
Okay. Are you currently in a romantic relationship?
Yes. Yeah, guess you could say romantic.
Okay.
Yes.
How long have you been in this relationship?
7 years.
7 years, okay. And how would you scale it?
7.
7.
Yeah.
7 is a good.
7.
7 is a good number. It's a number of completion. So it's.
Oh.
It's a
there
good,
you go. Glass half full, positive.
It's a good number. In the last year, have you experienced any significant life changes or stress? Anything that has caused you to feel, a bit overwhelmed?
Yeah, I think the biggest thing I can point to is I have a stepdaughter who is very difficult to deal with, and she suffers from mood disorders and a bunch of other things, and I'm quite often her target, and it's been very hard to have her home, and it's very stressful on the family.
Okay, understand.
It's been difficult.
Okay, so have you experienced any extreme depressed mood?
I would have to say yes.
Okay, what about wild mood swings?
I'm going to say no.
Okay.
Yeah, family might say yes, but I'm going to say no.
Okay, you know yourself better than the family.
Yes. Like no.
Any rapid speech?
No.
Extreme anxiety?
Yes.
Okay.
Yes.
Panic attacks?
No.
No panic attack. Do you have sleep disturbance?
No, I'm okay.
Okay. Hallucination?
No.
Unexplained weight loss? Unexplained loss of time?
No.
Okay. Unexplained memory lapse?
No.
Okay. No alcohol or substance abuse?
No.
Okay. Do you have any frequent body complaints?
Yes, the upset stomach.
Okay, got you. Any eating disorder?
No.
Okay.
I mean, I'm not eating much, but that's not.
Yeah, that's not something that you, struggle with.
Yeah,
Okay.
yeah.
Any body image problem?
No.
Repetitive thoughts, any constant thought that you have flowing?
Yeah,
Okay.
I would say, yeah. Get
Oh,
something stuck in my head.
okay. Any behavior pattern where you find yourself washing your hands or checking something constantly?
No, no.
Okay. No homicidal thoughts, right?
Right.
No suicidal attempts?
No. Mm-mm.
Okay, this time I'm going to try to get some information about your occupation as to see if this is also a factor that played into the feeling that you're experiencing. Do you work?
No.
Okay.
No.
Okay, let's see how let's ask some questions about your your spirituality. Do you consider yourself to be religious?
Yes.
And your faith is?
Christian?
Okay, that's good. I'm going to see how we could get a better understanding by checking your family mental history background. So, everything
Okay.
plays a extreme factor in everything that goes on with us. Because sometimes we do inherit stuff. And sometimes we're in an environment, and then that environment at the end of the day is not conducive to us, so we grow up with certain patterns and start doing some stuff based on what we have experienced in time past. Has anyone in your family, either immediate family members or relative, experience any difficulties with the following? Whether parents or sibling, depression?
Okay. Yes, I would say my mom.
Okay. Bipolar disorder?
No.
Okay. Anxiety?
No.
Okay. Panic attacks?
No.
Schizophrenia? Schizophrenia? Okay. Substance or alcohol abuse?
No.
Okay. Eating disorder?
No.
Learning disabilities?
No.
Okay. Trauma or suicidal attempts?
Nope.
Okay.
No.
All right.
No, sorry.
So I'm going to ask you at least 4 more questions just to get a better understanding. What do you consider to be your strength?
I consider. You see, I'm organized.
Yes.
And so I would consider that a strength.
Okay. 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 What do you like most about yourself?
I like most about myself. I like my sense of humor.
Okay.
I think
That's a good strength.
Yeah.
And that's a method to cope with too also. Always smiling and laughing. That helps.
Even if it's just at myself, it's good.
If it's very helpful. I'm telling you, it's very effective. I do it a lot. What are effective coping strategies that you have learned that has helped you when you're feeling a bit overwhelmed or feeling a bit depressed?
Well, the exercising is definitely a coping strategy. It's
Okay.
It's to get me out of the house and get me social because I'm a stay-at-home mom.
Okay.
And it gets me around friends, and it gives me an hour of my time.
Okay.
My husband works odd hours because he's an emergency medicine doctor.
Okay.
So sometimes he's home and sometimes he's not, and carving out time. So the kids really fall to me. The house falls to me.
Okay.
So it's that time is mine. So I think that helps.
Okay. What are your goals for therapy?
My goals for therapy. I would like to find a way to control the anxiety that I'm feeling
Okay.
often. To find better tools.
Okay.
To, maybe more immediate ones rather
Okay.
than like I have to wait until tomorrow to go run this out.
Okay.
Something that's
Okay.
more
Based up.
immediate.
Okay, that's very good. But based upon everything that I've heard, I realize that you're facing a bit of anxiety, between anxiety and depression. And the reason for that is you are in a stressful situation where you have your stepdaughter who is not mentally, and then you're receiving a lot of attacks. So sometimes when you're trying to keep the peace and you're trying to hold everything in, you find yourself in a depressive mood. And when you're not able to say exactly how you feel because you don't want to come off as being the bad person or being wrong, all these emotion just ties in, and then you find yourself just want to be left alone. I just want. So this is a space of, where depression really do creep in. And then you having that feeling of anxious. If I set something to happen right now, this hour, and it does not happen in that minute, then I feel as if I'm out of place. I need everything to run according to schedule, how I place it. And then you have the kids, you have the house, you have this. But what a lot of people don't understand, that being a stay home mom, it does carry a lot of weight. And when you're not able to be around people of your own age group, or you can able to socialize and have a conversation, it will bring you into a depressive mood. So I do believe that you're between the borderline between anxiety and depression. And I first would recommend you to do a self inventory. I think that would be a good thing. Finding out what makes me sad. What is it that caused me to react? Do I share my feeling at the same time, or do I keep it in just to make everyone? Do I just keep smiling just to keep the hurt in? So these things are sometimes that we internalize things, and then when we're not able to express it, it does cause us to fall into a place of depression. But I do believe that Beck's depression inventory will be something that you could try on your own, and then to see how the score is. And when we meet the next time, then we're able to see where you are because there's different level to anxiety and depression and stuff like that. But I also do believe that it's okay to voice your opinion. Is okay to say how you feel. It's okay to cry, because sometimes the best tool is to just shed a couple tears and just keep it moving. Or just anytime you find that place where you're going into a space that you don't want to be in, take yourself away from the situation. I don't have to argue with you. I'm going to have myself a me time. I'm going to turn on some meditative music. I'm going to lock down for 20 minutes. I'm going to hide away from everyone. I'm going to focus on me, because if I'm not good, nobody's going to be good in the house. So it's time. So I'm going to spend some time for me. And I do believe that solitude helps a lot. Solitude does help, and prayer does help. As for me, that is something that I constantly do. I constantly pray, because the word said, if I keep my mind on him, he will keep me in perfect peace. So I constantly pray, and things that I know that I cannot control, I say, God, I can't control it, but if you just create a way for me to see it. And sometimes just walking around observing the beauty and the fresh air will cause you to find so much peace. Because you don't want to find yourself in a place that was not designed for you. So if you meditate, and if you just have a journal and begin to write down what caused me to feel like this today, or what is it that I tried yesterday that caused me to be upbeat and caused me to have a fresh perspective on things. Remember, at the end of the day, you're always the one who can change the circumstances around you. You're the one that everyone is looking to. You're the one that everyone is running to. So if they can't run to you, they got to run somewhere else, because this time I'm taking my me time. I'm getting away from everyone else. If I lock my door, it means that I don't want to be disturbed. I'm going to turn up some meditation. Y'all not going to hear me. I'm not listening. So these are some tools that I do believe that would help you to be to have a sense of peace, and that you don't have to find yourself into any form of anxiety or feel feel depressed because of what's going on around you. And I do believe that the more that you write your thoughts down and you're able to read it, you will feel 100%, because you're like, okay, today I felt like this, but tomorrow I'll feel this way. And it's good just to socialize. And if you could find someone who you trust, who you could share your thoughts with, and they won't take it the wrong way, that would be a good thing for you also, because sometimes when you do share, people misunderstand what you're saying. All I'm saying to you that is just that I just need to relate to someone of my own age. I need you to know that even though I'm not working outside, I'm working inside, and my work is just as important as the one that you're doing outside. So don't think because I'm home mean that I'm not doing nothing.
Yeah.
You come home to a clean house. You come home, your kids looking good. Dinner is ready. So give me some credits. Let me go.
Absolutely.
Let me go shopping for a day or two. Just give me some time. But it's good. Just probably find every now and again go to the spa. Just relax and bask. But the first thing I have to do, just do that assessment, that inventory, and see where you are. And then try meditation, try just praying. Even if it's just 2 times out of the day, just take away some time and just pray. I do, as for myself, I pray 7, 12 p.m. and at night. So I pray at least 3 times per day, and I read a scripture. Like, find scriptures that is going to keep your mind focused and keep your spirit up, because you're going to need that. You're going to need that. So if you practice some of these, I do believe that you will see a dramatic change. And if that doesn't work, which I know it will work, we could go further.